Have you ever had a headache before? Well, of course we've all had it. In fact, it's considered the most common sort of pain experienced by humans. Headaches could come in different forms, like dull aching, sharp and throbbing, or even pain behind one of the eyes. There are so many kinds of headaches. The good news is that most of the headaches, 95%, are due to a benign cause. However, it sometimes may be a symptom of a condition that is really serious. In this video, we're going to give you an idea about the different kinds of headaches and some of the treatments available for headache, so we hope you'll like it. Alright then, let us begin with understanding what is headache. One of the very interesting facts is that although our brain is responsible for the pain sensation of the whole body, the brain itself is insensitive to pain, because there's no pain receptors in the brain. For example, patients with brain damage such as stroke could very rarely come with headache. How do we get headache then? Well, most of the time, headache is due to stretch in the meninges, which are the coverings of the brain, or the arteries and veins that deliver blood to and from our brain. Let's now move on to the different types of headache. The first one is called tension headache, which feels like a tightness or squeezing in your forehead and temples. It's the most common type of headache and is usually mild or moderate in terms of severity. The next type of headache is called migraine, which is a way more severe and recurrent form of headache than the previous one. It's actually the most form of headache that people would go see a doctor for. Around 10 to 15% of adults and children experience migraine. Most of those people have one of their family members with the same condition. Which means that some people are born with a migraine-sensitive brain. Such people are liable for migraine when exposed to a certain amount of noise, lights, or smells that'd feel okay to the ordinary people. Weather change, work or school stress, or periods could also trigger migraine. Migraine usually starts with phase called prodrome, which, when people get, they predict they're going to have an episode of migraine. Prodrome symptoms include food cravings and yawning. Not all but some of the migraine patients experience something called the aura, which is visual problems, numbness, and inability to speak properly. All this happens before the headache starts. Then comes the headache in the form of a throbbing pain in the head and irritability, often accompanied by nausea, and also you may become excessively bothered by the noise and the light. This stage may last from 4 hours up to 3 days. After the headache subsides, one feels some tiredness, hangover, and difficulty thinking as well. We're going to discuss how to deal with migraine by the end of this video. The next type of headache is called hormonal headache. This type, in fact, is why headache is common in females during their periods. Exactly like the name says, it's hormonal, i.e. related to estrogen. During or shortly before periods, estrogen levels fall down markedly after they have been up in the air, which could of course cause headache. Next, we need to say that headache could be part of the symptoms of a certain disease or an infection, such as influenza. In these cases, headache goes away after your body has cleared the infection. Now, it's time for the most practical part. What do I do when I have a headache? Okay, people with all kinds of headaches should drink plenty of water, live healthy, and stick to a consistent sleep schedule. In addition, people with migraine can prevent episodes of headache when they're at their earliest phase, prodrome, by learning some relaxation and distraction techniques. Many over-the-counter medications help with headaches. The two most common ones are ibuprofen and paracetamol.